Hello everyone. Today we're going to go over step-by-step approach for CCS exam. One of the biggest challenges of the CS exam is knowing what to do next. And once you get these steps down, I guarantee you will manage your cases really well. You will do everything you need to do to get the maximum points. You will see your cases are ending early. I recommend after listening to this video, go to your CCS case banks, do the cases, then you will see the results yourself. Step 1 for all CCS cases, see if the patient is stable or unstable. If the patient is stable, has no life-threatening conditions, do the physical exam. If patient is not stable or has life-threatening conditions, do the emergency management first, then do the physical exam. Otherwise, you will lose a lot of points. So get IV access, IV fluids, oxygen, vitals, plus also do the case-specific or emergency management. If the patient is in the clinic and not stable, make sure to transfer the patient to the ER, then do the emergency management. Step 2 is a complete or focused physical exam. If the patient is stable, do the complete physical exam. If patient is not stable or has life-threatening condition, do the targeted physical exam. Do the heart, lungs plus targeted organ, and do rest of the physical exam while waiting for the lab results. Step 3 is lab works. For all CCS cases, you should get CBC, urinalysis, BMP, chest X-ray. But for all reproductive age women, make sure to do the urine pregnancy test and do the chest X-ray only after urine pregnancy test is negative. And plus also do the organ specific labs. Step 4 is medicine. If after initial labs you already know the diagnosis, you can give the patient medicine, or at this point also see if you need to stop some medicine. For example, if the woman has DVT, stop oral contraceptive pills. If patient came with signs and symptoms of MI, stop metformin, because you'll have to do angiography. But make sure you should also check if patient is allergic to any medicine. Step 5 is location. If patient is stable, you already know the diagnosis, and give the patient medicine, send patient home, and schedule a follow-up appointment. If the patient requires hospitalization, make sure you should know where you should place the patient. If patient is not stable, keep the patient in ER. If patient has MI, diabetes mellitus 1, send the patient in ICU. If patient is stable but needs further hospital monitoring, such as patient with osteomyelitis, meningitis, pericarditis, you can transfer this patient to the wards. If you're keeping patient in the hospital, make sure to order following. Make sure to type the diet, what type diet you want patient to be. Do you want patient to be on a complete bed rest or the bed rest with bathroom privileges? Make sure to do the vitals every 8 hours. Step 6 is labs and consultation of specialists. If patient came back for the follow-up appointment, check if you need to order more labs, such as biopsy, colonoscopy. If patient was already in the hospital, check if you need to order more labs, such as if a patient has MI, order angiography to determine the extent and number of coronary artery block. If the patient had a stroke, TIA, order carotid angiography. At this time, also see if for any reason you had to order culture and sensitivity. If culture and sensitivity results are back, you can switch the medicine to the sensitive medicine. Step 7, see if the patient needs more medicine. Sometimes you put patient on medicine, but one medicine is not controlling patient symptoms, so you have to add medicine. Also surgery. If the patient needs surgery, you can schedule the patient for surgery. such as after a coronary angiography, see if the person needs the coronary grafts. Some patient probably just need reassurance, or some patient you will have to do interval follow-ups. Step 8. Most of the CCS cases will end after this step. Follow-up: if the patient was sent home, move the clock forward to the next follow-up appointment. Patient should feel better and case will end there. If the patient was hospitalized and the patient was in the wards, follow up with labs every day, and you will see the patient is getting better, and once the patient gets better, case will end. If a patient needs a surgery, make sure to order pre-surgery labs, do the PT, PTT, INR, IV antibiotics, IV fluids, move the clock forward to get these results, then move the clock forward to get the surgery results. The case will just end there. On 2-minute screening, or even before sending patient home, make sure to do basic counseling for all the patient. Wear seat belts, no smoking, no drinking, safe sex, no drugs. Also do age and gender specific screening. For all women's, pap smear, see if the woman is above 50, mammogram. If older males, do the colonoscopy. If the patient is pregnant, influenza shot, and make sure to also do the case specific counseling. For example, if the patient has a factor A deficiency, advise patient to avoid aspirin. Also do the diet counseling, suicide counseling. If you're sending patient home, make sure to cancel the labs no longer needed. For all you have to do is just double click or right click on the order, hit cancel. Alright, this concludes our step-by-step approach for CCS exam.